Hi guys, welcome back to G Chats with your host G. We are in the G spot, and in today's episode we are going to be talking about STIs. Not the funnest isn't even a word, not the most fun topic, but it is a very important topic because STIs are a rampant problem, especially in the United States. And I do believe that the reason they run rampant is because there's a lack of education. And so talking about STIs is super, super important. There is a stigma around STIs, which is why I feel like so many people don't talk about it. And I do want to highlight the fact that I refer to them as STIs and not STDs. I know that for years and years and years, and even in like my parents' generation, they refer to them as STDs. They are like STIs, like we don't say STIs, but we should, and we should switch that terminology because the medical community has transitioned it from STDs to STIs for a reason. It was intentional, both medically and socially. So there's a reason why we refer to STIs as STIs and not STDs anymore. And there's a medical reason for that, psychological and social reason. And I just want to highlight that before we get into talking about the science of STIs and why the vaginal microbiome is important. So I have my notes here that I want to keep handy so that I can give you guys all of the accurate information that came from my brain when I was information dumping. And the first, of course, is the fact that there's been a shift from going from STDs to STIs. And as I mentioned, there's two main reasons. Number one is the medical reason, and it's that infection is more accurate than disease. And this is because an infection means that a pathogen has entered the body and it's replicating. That's what an infection is. And most times when we're saying a pathogen, it's a bad guy that shouldn't be in your body, right? Like a bad guy that shouldn't be there. That's why like strep throat is an infection. Like it's invading the throat, it's replicating, and it's causing problems. A disease, on the other hand, means that the infection has caused clinical symptoms or damage. And so many STIs, things like chlamydia, HPV, and even gonorrhea, they are a lot of times asymptomatic, meaning that people have acquired this bacteria and the bacteria is replicating, but they're not having any obvious clinical symptoms. And for that reason, a lot of times, unfortunately, STIs can go undetected and not really like underdiagnosed and not really found because a woman is not having symptoms, or even a man, they're not having symptoms. And so being asymptomatic kind of takes out that like disease aspect of it because it's not causing damage. It's not something that is maybe showing clinical symptoms, but it's still there. So it is an infection rather than a disease, if you will. And so switching to STI reflects that you can be infected and you can be contagious even if you feel perfectly fine. And that is important for the things I just talked about: early detection, screening recommendations, and reducing the stigma. The word STD, or the phrasing of STD, was really not used for any medical reason, more so to just inflict shame and stigma on people experiencing STIs and battling STIs. And so there's a lot of stigma around the conversation of STDs and STIs. For years and years and years, people felt scared, afraid, unsure of what to do. So I'm really glad that the medical community decided to choose I instead of using the disease description, because it is far more accurate and far more appropriate, and it doesn't have as much shame that's associated with it and rooted in it. Now, part of that leading into this is the psychological and social reasons. There's less stigma and there's more clarity. So disease honestly does sound frightening, dirty, shameful, terminal. Like when you say somebody has a disease, you think like it can't be treated. You think, oh my God, it's like a terminal illness, like, or a chronic issue. Disease sounds scary than like, oh, they have an infection. Infections, and especially a lot of STIs, are uncomplicated. Like they are treated with antibiotics and other medication depending on what the pathogen is. Obviously there are some that can't be treated, to which there is there's better medical terminology. Like we all know of HIV. But HIV itself is the virus and it can turn into AIDS. So that is a disease. So saying like STDs just sounds very like frightening, scary, shameful, and there's a lot of stigma that's associated with it. Infection sounds more clinical, it's more temporary and more treatable, and the term STI reduces the stigma and it makes it easier for people to seek testing, treatment, and talk openly. And I think it's important to talk about this because a lot of people don't realize that like the psychological aspect of taking care of your reproductive organs, particularly for women, is huge. It's not something where like people are their biggest advocate because they know better. They know they should. Like when society has kind of ingrained things in your brain, it does put you off from being your own advocate. That's a real thing. Like it's not something that we should just like not talk about or something that we should pretend doesn't exist. It does exist. And it's really, really important that the medical community, thankfully, acknowledge that and recognize that. And so this does shift with broader public health goals because ultimately we see that STIs are rising, and unfortunately, we have so many policies that want to try to dictate people's bodies and try to push like abstinence only. And that is just not the reality of life. People are going to have intercourse, whether you agree with it or not. People are going to have intercourse. And instead of shaming people and pushing these ridiculous abstinence only type of programs, what we should do is give people the access to normalizing the conversation so that they can increase testing and decrease transmission, right? When we start normalizing the conversation, then we can bet on people getting tested because they know better, even asymptomatic people, where like if they feel like maybe I was exposed or I had a one night stand and I don't know, I don't feel safe, I didn't use protection, I forgot to use protection, it was in the heat of the moment, whatever, they can feel comfortable with going to a clinic and getting testing because the conversation is more normalized, and this decreases transmission because if more people are getting tested, there's a greater chance for detection, and if we're detecting more people, we can treat more people and prevent further transmission down the line. And that is so important. So I just hate to see that there's so many like abstinence only programs and things like that. Like, screw what you believe in. Who cares? Like people are not going to follow your way of thinking, your rules. Like people are going to have intercourse no matter how much you try to explain your point of view on it. People are going to. So let's give them the right information, the right scientifically backed information so that they have access to, and give them access to testing, give them access to treatment so that people aren't continuously transmitting them. Because as you'll see like later in this episode, STIs aren't something to mess around with, and there's a strong reason for that, and I will get into it a little bit later. But yeah, so switching the conversation from STDs, or the terminology from STD to STI, is so important, and it was very needed both medically and socially. So I'm really glad that did happen, and I'm hopeful that other things in medical terminology can change over time. But ultimately, an STI is a pathogen, whether that's a virus, a bacteria, a parasite. It's present in the body, and it's preferred in public health now and in medicine. STD is the infection causing symptoms or disease, and that can happen. But here's the thing: a lot of STIs turn into STDs when they're untreated. So as we talked about, HIV can turn into AIDS. That's a specific disease. Chlamydia, gonorrhea, these things can turn into pelvic inflammatory disease if they're untreated. So like the infection itself's not the disease. It can cause disease, but the infection itself is not a disease. So I hope that makes sense. And I hope that you guys are also excited about that change. If you do use STD in your vocabulary, I totally recommend switching it out and starting to use STI because it is more medically accurate and socially acceptable. And in public health, it's important that we start using it to help with reducing the shame. So now I want to talk about actual STIs. So in this episode, I am differentiating true STIs from sexually associated bacteria. And that is so, so, so important. It's very important that we talk about, because there's a lot of conversations, and I'm someone who grew up thinking that UTIs, yeast infections, BV is sexually transmitted, and that's not true. It's not true, and we need to have this differentiation and this distinction, because it helps with diagnosis, it helps with treatment, it helps with conversations and stigma and all of that. So we do need to separate the two. So the first section I'm going to go through is true STIs. These are pathogens that are primarily or exclusively transmitted through sexual activity, all of the sexual activity, oral, vaginal, anal, genital to genital, and cause infection upon transmission. So the first pathogen we have is none other than chlamydia. Chlamydia is a bacteria, and it primarily infects the cervix and the urethra. Its consequences, if it's left untreated, is pelvic inflammatory disease, infertility, and ectopic pregnancies. Number 2 is gonorrhea. It is also a bacteria, primarily infects the cervix, the urethra, the rectum, and the throat. It can cause pelvic inflammatory disease, infertility, and arthritis if left untreated. Number 3, we have syphilis. Syphilis is also a bacteria infecting systemically the genitals, the anal region, and oral mucosa. And it can then lead to neurological complications and miscarriages, again, if left untreated. So when I'm talking about the consequences, they're all consequences if this is left untreated, if this STI is left untreated. So next up, we have Mycoplasma genitalium, and this is different because there's many different Mycoplasma strains, but Mycoplasma genitalium in specific is an STI. It's a bacteria, and it infects the cervix, the endometrium, and the urethra. If left untreated, it can cause pelvic inflammatory disease, resistance to antibiotics. Then we have Trichomonas vaginalis. It is a parasite, and it can infect the vagina and the urethra. It can cause vaginitis, pregnancy complications. Then we have HSV, which is the herpes simplex virus. It is a virus, not a bacteria, and it infects the genital skin, the mucosa, and it can cause painful ulcers, lifelong infections, and neonatal herpes if left untreated. We have HPV, human papillomavirus, which of course is a virus. It infects the cervix, the vulva, the vagina, the anus, and it can cause cervical cancer and genital warts. HIV, human immunodeficiency virus. Its primary infection site is blood, semen, and vaginal fluid. It can cause immunosuppression and AIDS, of course. And then we have hepatitis B, HBV, and it's a virus, and it can infect the blood, semen, and vaginal fluids. It can cause liver disease and chronic infection. These are true STIs. They are sexually transmitted, and it's the main mode that it is spread, and infection is highly likely once transmission does occur. Next up, we have sexually associated, but they're not STIs. So what does this mean? This means that the organism can be transferred. The organism can be transferred through sexual activity. However, they're not always sexually transmitted, meaning that they can exist outside of sexual activity. Sexual activity is not the primary mode of how they get into the genitals, but they can be. It's possible because we share pathogens all the time. Transmission also, in this case, for sexually associated, transmission doesn't always result in infection, especially in healthy individuals. So you can contract, if you will, as in like this could be introduced into your vaginal flora through intercourse, and nothing will happen because you're a healthy individual. And they are often a part of a normal flora, and they might be opportunistic. So this means that while they are seen as a bad guy, all of these, they're bad guys. Sometimes they're a part of the normal genital tract, because it's really important to remember, and I've said it so many times, nothing in your body is sterile. There's good and bad of everything, and that includes bacteria. There's good bacteria, there's bad bacteria living in your vagina. There is bad bacteria in your vagina. Whether you want to believe it or not, there is. And it's just not causing problems, because you should have more good bacteria than bad bacteria, because this good bacteria is protecting you. So ultimately, when you have just a little bit of these bad guys, that is normal. They only really are opportunistic because they cause a problem when they have the opportunity, and that opportunity is the lack of good bacteria. And when we're talking about sexually associated, it's important to remember that they can be, as I already mentioned, there are medical terminologies for them being sexually associated. They can also be vertical acquisition, meaning that they can be acquired from the parent to the baby. And then they can also be endogenous. And endogenous basically means that the infection arises from microbes already present in our own body, usually a part of your normal flora, but they overgrow or shift location and cause problems when good bacteria dies off. So there are medical terminologies for it. So when I am going over the sexually associated pathogens, I will also mention if they are vertical, like whether they can be passed from a parent to a baby, and whether they are endogenous, meaning that they can live naturally inside of a healthy individual. So the first up is Mycoplasma hominins. It is a molecule bacteria, and this can be transferred sexually or it can be endogenous, and it's often a part of the normal flora, but it is associated with BV and pelvic inflammatory disease, and we will talk about why that is. There's also ureaplasma, and it is a molecule bacteria. Again, it can be sexual, vertical, and endogenous. It's common in the vaginal flora, and it's pathogenic in some cases, particularly when you lose good bacteria. Candida albicans is a fungus. It's a type of yeast, and it can be endogenous, it can be sexual, and it can be environmental, meaning that, like, sure, you can pass it sexually, but again, it doesn't normally cause any problems. It is often in the normal flora. You just have more good bacteria than bad bacteria. Yeast infections are not STIs. They can arise and complications can occur when the natural yeast inside of your body overgrows because of underlying health conditions. It could be hormonally related, gut dysbiosis, your microbiome gets thrown off in your vagina. And this applies for BV. This is number 2, bacterial vaginosis. It's polymicrobial, and sexual transmission influences BV but doesn't cause it directly. And it stems from a microbial imbalance, and it's not from a single pathogen that causes the infection ultimately. And one of those pathogens is Gardnerella vaginalis, and I did kind of like include this as like a subheader because it is an anaerobic bacteria and it's endogenous, and it is sexually associated. So it can live in the vagina in very small amounts and not do absolutely anything, along with other anaerobic pathogens. It dominates usually in bacterial vaginosis, but it's not a true STI because, again, your vagina can come into contact with Gardnerella and not have an infection and not cause any problems, because transmission doesn't equal infection unless the vaginal microbiome is already compromised, like you don't have good bacteria there to protect you. And then we have group B strep, which is also known as GBS. If you've been pregnant, you've probably heard of it because it's tested and screened for during pregnancy. It's part of the normal flora. It can be vertical, so that's why we test for it, because a mother can pass it down to her baby. It can be endogenous, and it can be sexually transferred. It's also important to note that group B strep can grow or be present in your pregnancy swab if your vaginal microbiome gets thrown off. People with normal and balanced vaginal floras most times don't have GBS, but it is possible to still have group B strep in your vagina even with a healthy flora. But usually a healthy flora kind of eliminates group B strep, and that's the constant theme that we're going to talk about for most of these STIs. And then we have UTIs, and specifically E. coli, which is a UTI pathogen. Again, it is not an STI. It is a bacteria that sexual activity can facilitate transfer. It can push bacteria around because sex is messy, but it's not an STI. It's transferred from our gut. Our gut is responsible for it. It doesn't come from a man or a sexual partner. So these are not true STIs. Sex can facilitate their transmission or overgrowth or disrupt the natural environment, but they're not inherently sexually transmitted pathogens. Their behavior depends heavily on immune status, microbiome balance, and hormonal context. And this matters again for medical accuracy. It prevents an overdiagnosis of STIs or unnecessary stigma around natural flora. The stigma reduction is really important for this because it helps people understand that not all vaginal issues are sexually transmitted or caused by sexual behavior, because it's always linked to being promiscuous, and that's not helpful. And it does help with treatment clarity because true STIs require partner treatment and public health tracking. So sexually associated infections might not. And that's just really important for public health. So I did want to bring up something, and I hope that you guys listening may have caught on to it. But if you were paying attention, what you will see is that a lot of these STIs that I talked about, chlamydia, gonorrhea, they pretty much all of them don't infect the vagina. And you guys are probably like, wait, I didn't catch on to that. But most of these STIs infect the cervix. And I think that that's really important because even when I was younger, I didn't know that. When you think of STIs, you definitely think of the vagina, right? When a woman has an STI. And this is super, super important to talk about. So the reason why STIs prefer to infect the cervix rather than the vagina is because the cervical cells are more susceptible. The cervix, especially the transformation zone, which is where the squamous and then the columnar cells, they meet. And it's made up of one singular layer of the columnar epithelial cells that are, number one, more delicate and less protective than the vagina's multi-layered squamous epithelium. And number two, they allow easier pathogen entry, especially for organisms like chlamydia, gonorrhea, and HPV. And the vagina, in contrast, is lined with thick, stratified squamous epithelial cells, and these act as a physical barrier to the bacteria and to infection. So they're also more acidic and constantly shedding, which limits the microbial invasion if your vagina is balanced and healthy, right? And we'll talk about why supporting a healthy vaginal microbiome is super important. But cervical mucus is also a conduit and a target because cervical mucus can trap pathogens during certain phases of our menstrual cycle, especially when it's thick and acidic. So when our cervical mucus is thick and acidic, it's being protective and it protects us. But during ovulation, we know that our cervical fluid gets more watery and alkaline, and it does make it easier for pathogens to pass through. And so this creates a window of vulnerability, which many STIs do then exploit and take advantage of. And the cervix is a gateway to the upper reproductive tract. So these pathogens want to infect the cervix so that they can climb up the reproductive tract. So STIs that infect the cervix, like gonorrhea and chlamydia and even Mycoplasma genitalium, they often do so because infecting the cervix gives them access to the uterus, the fallopian tubes, the ovaries. And once they're there, they can cause pelvic inflammatory disease, tubal scarring, and ectopic pregnancies, and even infertility. And in contrast, vaginal infections like trich, for example, are localized. And unless the vaginal microbiome is severely disrupted, they stay within the vagina. HPV targets basal cervical cells. HPV requires microabrasions to access the basal epithelial layer of the cervix, and this is common during sex and or trauma. The transformation zone of the cervix is a major target because it's an area of active cell division, and this is why HPV-related cancers develop in the cervix and not the vagina unless HPV infects the vaginal introitus in specific cases. And so this misconception exists because vaginal infection is often used for any infection that's down there. And most symptoms like discharge, burning, or even odor do occur in the vagina, but the infection source is in the cervix. Your vagina is just doing its self-cleaning work, and it's recognizing that something's wrong in the area. But the infection's not in the vagina, it's in the cervix. And cervicitis can mimic vaginitis, but they're anatomically and microbiologically different, and that's really important to discuss. So the cervix, not the vagina, is the primary site for many true STIs like chlamydia, gonorrhea, and mycoplasma genitalium because it's more vulnerable on a cellular level, and it acts as a gateway to the upper reproductive tract, and it has mucus that does change throughout the cycle, which makes the cervix more vulnerable because it's a better environment for true STIs. So when we talk about that, though, obviously when you're having intercourse, the first line here is your vagina. And it's really important to note that a healthy vagina can actually help reduce your risk of your cervix contracting it. So the vagina is a defense powerhouse, and I cannot stress this enough. The vaginal microbiome is dominated by lactobacillus, and a healthy vaginal microbiome is colonized by multiple lactobacillus strains: lactobacillus jenseni, lactobacillus rhamnosus, reuteri, gasseri, plantarum. Like, the list goes on and on and on. And these bacteria produce lactic acid, which keeps the pH low, about a 3.8 to a 4.5, and it makes the environment hostile to bad guys like STIs. They also produce hydrogen peroxide, which is an antimicrobial, and bacteriocins, which are also antimicrobial, natural antibiotics and natural antimicrobials that stop the invaders. So a well-populated lactobacillus ecosystem is like a built-in security system. It protects you essentially. And this then supports your vagina's tissue. Your vaginal tissue should be thick, and its stratified squamous epithelium is the reason that it is so thick. And not just good bacteria and a healthy and balanced vaginal microbiome supports this, but balanced estrogen. Both of these, when you have good bacteria and balanced estrogen, supports the thickness, the elasticity, and the moisture, which is why we see people who are going through menopause, they have a dip in estrogen, and we see thinning of the vaginal tissue, dryness, and a lack of good bacteria. And we see this atrophy starting to happen because of the dip of estrogen. So the vaginal, in a healthy, it's someone with a healthy vaginal microbiome where it's very diverse and it has its good bacteria, and you don't have any hormonal conditions, you have your balanced estrogen. The vaginal lining is multi-layered, which acts as an armor. It's continuously shedding because it's physically removing microbes. That's its job. It does that. And it's estrogen responsive, as I mentioned. High estrogen thickens the lining and it boosts glycogen, which glycogen is a polysaccharide that feeds lactobacillus. And compared to the cervix has a thinner single-layered columnar cells, especially in the transformation zone, and it's more susceptible to microbial adhesion and penetration. So why do most STIs ultimately infect the cervix and up and not the vagina? Number one is because the resilience of the vaginal environment. A healthy vaginal microbiome and acidic pH makes it very difficult for true STI pathogens to infect or even survive there. Number two is that pathogens prefer the cervical tissue. They just have a preference. STIs like chlamydia, gonorrhea, and HPV do evolve to affect the columnar epithelial cells, which are found in the cervix, not in the vaginal wall. And number three is that the cervix is the access point to the upper reproductive tract. So once it passes the cervix, pathogens can ascend to infect the uterus, fallopian tubes, and ovaries, and it can lead to serious complications like pelvic inflammatory disease. So you might be thinking like, okay, if this is true, then which pathogens do infect the vagina? Like what does infect the vagina if that's the case? So there's really, to be completely honest, not many. Pathogens that truly infect the vaginal wall are fewer in number, and they often need either dysbiosis, an imbalance in the vaginal microbiome, epithelial trauma, or direct epithelial affinity. And there's really only two pathogens that can cause issues in a healthy vaginal microbiome, but there's still an underlying issue, and that's HSV and Trichomonas, Trichomonas vaginalis, also shortened to just Trich. And that is because Trichomonas is a parasite and it burrows into the vaginal wall, and it can survive acidic and alkaline pH levels. So it can still infect the vagina even if the vagina is balanced, the microbiome is balanced. However, the risk is lower. For all of these STIs, your risk of contracting an STI is lower if you have a healthy vaginal microbiome, which is why I say taking care of your vagina is not just about the smell and taste. It is ultimately about your own health because it does reduce your risk of contracting a sexually transmitted infection. And then we have, as I just said, HSV, which is the herpes simplex virus. It infects the epithelial skin and the mucosa directly and is kind of independent of the pH itself. But it's really important because when it comes to epithelial affinity, HSV and Trich do kind of take over if there is direct epithelial affinity, which usually there is in that case. But bringing it all together, when the vagina is healthy, pathogens struggle to basically survive and hold on. STIs are more likely to bypass the vagina and infect the cervix, which is biologically more vulnerable in certain cases, but your risk is still reduced if you have a healthy and balanced vaginal microbiome. And vaginal symptoms like discharge or irritation when you have cervical infections like chlamydia and gonorrhea might appear, but it's because the infection is starting in the cervix and not in the vagina. Your vagina is not the infected part, it's the cervix that's infected. So when the vaginal microbiome is imbalanced, opportunistic pathogens like BV and yeast infections can take hold in the vaginal wall itself, and the immune defenses weaken, which allows the possibility of contracting an STI or allows an STI to persist or worsen. So that's really important to understanding. And I really wanted to cover the differences between true STIs, sexually associated, and then the fact that we refer to them as STIs and the fact that they ultimately need a good vaginal microbiome to kind of keep them away and be like, go away. So I hope that this video was super helpful for you guys. I hope that you learned something new. I love you guys so much, and I will see you in the next one. Bye, guys.